probably the number one supplement is fluids. You don't realize it, but I had surgery on my knee this summer, and I actually went and lifted weights before the surgery, and then when I presented to get my IV before surgery, the nurses had a hard time starting the IV because I was significantly dehydrated. So number one, you've got to hydrate, and you've got to hydrate with something that doesn't have caffeine in it. And we've been involved with Ball State University, and they've done several studies on both male and female athletes with the nutrient technology. There's basically 3 different supplements. Capsules, a powder, and then there's also a gel in the injury situation. And the number one thing on a supplement is to make sure that it's safe and that it works. Well, this supplement's been very safe. We haven't had any problems with it as far as kidneys, anything. And then as far as the effectiveness, they compared it to creatine, which is a pretty common supplement. And the strength gains were the same as they were with creatine, but the body fat went down, which obviously every athlete likes to increase their lean muscle mass and decrease their body fat. And then in some other studies, they showed in the blood levels that the cortisol levels went down using this supplement, and the testosterone levels went up. But again, both in the male and the female athletes. That's huge. I mean, from my standpoint, I will use it post-injury and pre and post-surgery for that very reason. We were talking earlier about ACL injuries. The common time for people to recover from an ACL is between 6 months and 12 months. And we've seen patients recover in 3 or 4 months when they've done the complement of the supplements, which is a combination of the capsules, the powder, and the gel, all 3. Well, and that's a good point. I mean, both of my sons, they're 21 and 18, and they've both been on the product for the last 8 to 10 years. And so obviously I believe it's safe, and it's been very effective in them and their weight training and their recovery. And the younger one swears that he's 2 inches taller than the 21-year-old because he started earlier. And there's a lot of theory about drinking pop and the detriments of that, and the NutriBuild and the NutriBuild powder. You can mix it with Gatorade, you can mix it with whatever you want, because a lot of times supplements don't taste good, and you can have the best supplement in the world, but the athlete won't take it. In this situation with the powder, you can add whatever you want to add to it, whatever flavor, orange, grape, whatever. And we've had a real strong compliance with it with our athletes first athletes. We've got some elite basketball players and some guys that are not well known, Sam Bradford and Blake Griffin, and guys like that who use the supplement because in these AAU tournaments you're having 5 to 6 games in a weekend, and they felt like it really helped them recover in those situations. Probably similar to when you're having a judo event where you're having multiple competitions in a weekend. I mean, this supplement is a combination of branched chain amino acids, which is protein, and then it's got a very, very good quality protein, and it's got also the carbohydrate. And some of the athletes, some of the elite athletes, when they go international, they actually almost use it as their meal, because if you're in China or you're in wherever and you don't like what's being served, then you up the supplement. Obviously you still need to eat, but exactly what you're saying, it's everything in it is scientifically proven, and there's nothing in it that would cause any increase in tendon injuries or increase in dehydration and those types of things which you see with some of the more exotic supplements. Correct. No problems with testing. It's gone through the NFL. It's gone through Major League Baseball, and no problems there at all.
And has it been used in? I think it's been used in Olympics.
Yes.
Prior.
Yes. Well, the number one is to get it properly diagnosed. So many times athletes will just, deny an injury, and then an acute injury becomes a chronic injury, and then before you know it, then it's a season-ending injury. So number one is get the right diagnosis. Number two would be to rest, rest, ice compression, and elevation, which is any acute injury. Number three would be, what we've done. I take care of several football teams in the area, high school and college, and there's an injury called an MCL injury, which is the ligament on the inside part of the knee, which also occurs in judo and martial arts. And traditionally, that's a 6-week injury, and with proper bracing and proper rice and those things, with the combination of the capsules and the powder and the gel, we're getting most of these kids back in 2 weeks, back to play with the brace on versus 6 weeks. So that's pretty significant for anybody who's competing, but especially for a senior in high school, this is his last hurrah and he's not going to play college. And for the parent standpoint, that we get better healing, we get a more stable knee, we get that patient anabolic quicker so that he can heal that knee so it doesn't give him problems down the road.